All right, happy Tuesday, everybody. It is Tuesday at 5:30, and it is time for our live Q&A. Coming live from the Woodlands Plastic Surgery. I'm Dr. Correa, and let's get to it. We've got a bunch of questions this week. I don't know if we'll get through them all, but we'll do our best. Let's see. So at the top of the list is fat grafting to the breast. So fat grafting to the breast is Fat grafting is a well-established technique, been around a long time, very useful surgical technique. We use it for Brazilian butt lift or BBL. We use it in breast reconstruction, other reconstructive techniques all the time. It's only in the last 5 to 8 to 10 years that fat grafting has been used in the breast for cosmetic purposes. There's a couple guys who have been doing most of the research on that, and they've demonstrated some really promising results, but there are still problems with it when it comes to cosmetic purposes. The primary thing, number one, is getting enough volume where it actually makes a difference. It's difficult to inject enough fat that it makes a noticeable difference and have the fat survive and get a predictable result. For example, if you're a A cup or a small B cup breast and you're looking to get into a D cup category, which is a very common request, very difficult to get there in a single operation with fat grafting. So then you're looking at 2 operations, 2 sessions, et cetera. So there's practical limitations like that. And then on more of a safety side of things, there are concerns related to imaging the breast. And so regardless of what age you're at, when you get the fat grafting done, eventually you will be needing to get mammograms for just normal breast cancer screening. A quick PSA on breast cancer screening. Breast cancer is something where if you catch it early, it's very curable. Most people, pass from other reasons. If you catch it late because you haven't been following up with your screening, it's as scary as any other cancer. So make sure you get your mammograms. That being said, the fat grafting can lead to noise, shall we call it, on the mammograms, which can lead to either anxiety because you've got an abnormal finding. You might need extra imaging like an ultrasound. You might need more biopsies. There's not a concern that fat grafting would per se cause a cancer. That's not the concern. The concern is that it basically leads to noise on the mammogram, leading to either additional imaging, undue anxiety, or additional biopsies that you wouldn't ever need. And again, it just adds one more stumbling block to getting into your mammogram. If every year they're going to find some calcification that looks benign, but they need to just make sure that it's okay. And so fat grafting is well known to create calcifications in the breast. And the radiologist can tell the difference between scary calcifications or concerning calcifications and between ones that appear benign. But like I said, it can create noise in the mammogram, and so it can lead to problems in that regard. In my opinion, in general, practical considerations tend to take precedent because, again, you can only go so big with a single fat grafting session. And then shape is another very important thing. Many women who want breast augmentation, they want a change to the shape of their breast in some way, shape, or form, whether it's more roundness, more fullness up top, more curvaceousness. Maybe they want the fake boob look. You just can't get those things with fat grafting alone. Fat grafting very much would give you a completely perfectly natural breast that's just slightly bigger than what you currently have. And so the fraction of patients where fat grafting makes sense is just very small because of these practical considerations. And then when you take that small fraction and start talking about, well, you might end up having issues with mammograms and things like that, the number shrinks even more. And so it's just not very commonly done. I think it holds great promise. I think it's worth researching and exploring and all of that. But at this point, that's kind of the scoop on it. Tummy tuck versus liposuction. The short version, tummy tuck is essentially a skin operation and an abdominal, a waist narrowing and stomach flattening operation. It's very structural. It's fixing the muscles after babies, stretch them apart. It's excising extra skin that won't go away. Liposuction is a fat reduction technique. So you can liposuction until you're blue in the face, and sometimes we get blue in the face because if you're doing full body, it can be kind of tiring. But you can liposuction until you're blue in the face. It's not going to get rid of extra skin. And in fact, it actually makes extra skin worse. So patients sometimes think, well, I don't really want a tummy tuck. It's a big scar. Maybe I can just do lipo instead. And unfortunately, that's a source of a lot of bad results, is either people who aren't actual plastic surgeons doing liposuction and making bad decisions, and then it leaves people worse off. Or somebody, through whatever circumstances, just getting liposuction when what they really need is a tummy tuck. And that extra skin, it doesn't just magically shrink up and contract if it's been stretched out and lost elasticity. It just hangs more, and it actually looks less natural. It's hard for people not in the medical profession and people familiar with plastic surgery to understand or visualize that. But there's a difference between having something that you don't like that is a completely natural etiology, for example, extra skin in the lower belly, and something that looks like it had a botched operation on. Maybe you've seen that on TV, maybe you've seen photographs here or there, but the appearance of bad surgery always looks worse, in my opinion, than the appearance of a natural thing we don't like. And so you just want to be cautious with that. But the short version, the difference is basically tummy tuck gets rid of skin, tightens, flattens the abdomen. Liposuction is just a fat reduction technique. Technically, if you want to split hairs, yes, liposuction would kind of flatten the abdomen, because if you were this thick before liposuction and you're this thick after liposuction and you have amazing skin that contracts, then yes, it would flatten a little bit. But it's kind of a secondary effect. I don't know, the terminology is not perfect, but that's the primary difference. Most patients are going to benefit from some sort of skin excision procedure, unless you've never had babies and have absolutely perfect skin. Usually liposuction is kind of an adjunct procedure to, complement and enhance the tummy tuck. Number of patients who are just pure liposuction candidates, relatively small in the world of body contouring. But they're out there. If you're 20 years old and have some stubborn fat areas and all of that, and your skin has perfect elasticity and all of that, then you can very well get away with pure liposuction. So, all right. Belly button. Women have concern about how it will look after surgery. Why does it look different? You're hitting one of my special nerves here. Belly button is, I think we've touched on this on a previous episode, but there's nothing wrong with repetition. The belly button and a tummy tuck is kind of a pet peeve of mine in terms of having a bad belly button. This might sound silly, but I take some pride in my belly buttons, especially when you look at the results on websites. I mean, just about anyone can cut out some extra skin. It's not the most complex operation there is. When you're actually trying to shape an abdomen, improve its appearance, make it look natural, like there wasn't surgery, and the belly button is part of that. The belly button is the center of the abdomen. It's kind of the nose of the abdomen. It's a focal point. You see it, you notice it. Just like the nose on the face, there is such a thing as a cute nose, there is such a thing as a cute belly button, but in general, you want people to look past your belly button and look at everything else. You want people to look past your nose, look at the rest of your facial features. And so the belly button should blend in with the abdomen and not keep drawing your eyes back to it. What draws your eyes back to it? Basically signs that an operation was done. The most common reason that people get, in my opinion, an unattractive belly button after a tummy tuck is when the surgeon basically creates a scar that is like a circle drawn around the belly button. So imagine your own stomach or belly button right now, or anybody with a belly button, and basically just draw a circle around it about 1/4 inch wide, around the natural belly button, and pretend that's a scar. And I mean, if you go to somebody's website and you see that, keep hunting. It's just, there's just no excuse for it. I'm shocked that there are people who put that on their website and say, hey, look at this. I mean, it's shocking to me. So, generally speaking, the best way to get a nice belly button result is to leave it on the relatively smaller side. And it's not like anybody's chasing a bigger belly button anyway. And then you have to do it such that the scar stays on the inside part of the abdomen, and or on the inside part of the belly button, so that when you look at the belly button, you really can't see the scar. That being said, the belly button is a challenge. It's very difficult to get it to look perfectly natural. It's very difficult to recreate a completely perfectly shaped belly button surgically, because the nature of, we're getting kind of technical here, but the nature of trying to create a scar on a curved surface, it's difficult to get it to stay how you want it to stay, because scars want to contract. And so if you have something that's a circle, it wants to tighten up. We break it up by creating a V in there, and that prevents it from tightening up completely. But it's difficult to get that superior hood with the kind of tenting of the skin at the top, that smooth transition that then opens up down below, and that goes into that gentle convexity in the lower part of the abdomen. Very difficult to recreate that surgically. And so the best compromise is to create the scar such that it hides on the inside part of the belly button where the shadow is. So if you look at it, you can't immediately see the scar. And then there are techniques you can do to make the transition from the lower belly button into the convexity of the lower abdomen more subtle, so that it blends and, like I said, more or less does not draw undue attention to it. So that's kind of the scoop with tummy tuck scars. There are different techniques. I've kind of experimented with, I've either directly tried different techniques that I thought were all promising, or I've seen through my training and residency and all of that, techniques that I've, shall we say, been motivated not to pursue on my own, because I wasn't particularly awed by the results that I saw from it. And so, the technique that I've settled on, I've been pretty satisfied with. The patients I've had have been happy with it. I haven't had any patients with complaints specifically about the belly button at this point. Let's knock on wood on that. Can always happen. But again, it's one of those, it's in the category of appropriate attention to detail when doing an operation. And so, in my opinion, anything less than that is kind of a lack of the appropriate attention that you should be getting. Every aspect of the operation should be thought about and thoughtfully executed to get the best possible result. And even if we're in a world of compromise where we don't have an amazing option, you always do everything you can to get the best possible option, the best possible result. So anyway, like I said, one of my hot button issues, but if you're looking for tummy tucks, definitely take a look at the belly button on the websites. If it's blurry, be suspicious. So, oh, and then the last part of the question, why does it look different? I kind of addressed that, but it really boils down to the basically impossibility of recreating all of the belly button's a pretty complicated structure when you actually think about it or look at it. There's many different contours and adherence points and different bumps and grooves and things like that. And scars just don't behave like natural skin does. That's the short version, and that's why it looks different. So, tummy tuck scar. So, in addition to the scar on the belly button, so a standard full tummy tuck includes an incision around the belly button. And then includes an incision in the lower part of the belly. I try to keep it in the underwear line and the natural garment lines. Depending upon your anatomy, we can move that higher or lower depending on if you had a C-section or not. There is some variability in that based upon your anatomy, what your starting point is, and what our goals are. But the standard tummy tuck, tummy tuck scar is basically a low, mostly horizontal but slightly curved scar in the underwear line or garment line. And the goal is really to get it to hide in 85% of garments. I kind of joke with patients that you can find a garment that can expose virtually every part of your body while still technically being a garment. But if you're thinking of just average underwear, average bathing suits, average shorts and pants and stuff like that, it should basically be hiding in those natural garment lines. So let's see. And then tummy tuck versus mini versus 360. We spent a lot of time, I think, last week talking about tummy tuck versus full tummy tuck versus mini tummy tuck. I don't, in the interest of time, because we are getting already close to 5:45, I don't want to spend a ton of time on that. As far as the 360 goes, and I believe it was the last week's episode, so check that one out. And I put in the description whether, what questions we touch on. So take a look at that, and I go into detail, I think, on that. But tummy tuck versus mini versus 360. So these are all three different variations on a theme, and they essentially boil down to how much extra skin does a patient have. Everybody is attracted to the idea of a mini operation. It sounds cute. It sounds like a small recovery. It sounds like, oh, I don't need a ton of surgery, I just need a little bit. So everyone's naturally attracted to it. But at the end of the day, it's about using the right tool for the job. And what really, tummy tuck and body contouring is very anatomy driven, meaning what do you look like and what technique does it take to get a nice result. You can do a mini tummy tuck in somebody who needs a circumferential 360 tummy tuck. It's going to look like nothing. Actually, it'll look quite bizarre, frankly. It'll look like a botch job. It just won't look good. And so it's all about matching the right technique and accepting the relative trade-offs. Everybody wants no scar or a small scar. Depending on how much skin you have, that may or may not be feasible, and that's just the reality of things. And so it's, I spend obviously a lot of time on this in my consultations, but you just need to understand what the scar locations are, why we're doing what we're doing, and be okay with that. The breast is the same thing. Not, anybody who nobody wants a lift, that requires a scar. Everybody just wants an implant. Nobody wants a, significant scarring on the breast. And then ultimately you just weigh out, how do I look now? How do I want to look? How do I think I'll look? And would I rather get that with the scars, or would I rather stay the way I am? And ultimately, that's where the rubber hits the road and you make your decision. The 360 tummy tuck we have not touched on. The terminology can be confusing because there's a kind of popularized term lately of the Lipo 360, which basically refers to liposuction of the entire abdomen, flanks, lower back, sometimes upper back. And so it's just 360 degrees all the way around the torso, kind of to the level of below the breast, all the way around 360 degrees. Then there's what's called a circumferential tummy tuck, which refers to tummy tuck in the front, extending all the way around the hips, and then actually doing kind of a surgical buttock lift, not the fat grafting, but a buttock lift and lower back excision. That's typically applied to patients who have had massive weight loss. We're talking hundreds of pounds, generally speaking. Somebody who's lost 200 plus pounds, something like that, and they essentially get think of the tummy skin that hangs in the front after a baby. Kind of take that to the extreme and then put it all the way around from front to back, and that's your circumferential tummy tuck, or 360 tummy tuck if you want to call it that. But the scar extends all the way completely circumferentially around the waistline. I think that covers all the questions for this week. It's kind of brief on some of them, but again, in the interest of time, I don't want to keep people here for forever. So the goal is to be kind of quick and easy. I keep the questions coming. Love it. Nothing is out of bounds. I think we got one about a celebrity a couple of weeks ago. Send in your photos, we can do consults, if you're comfortable with it. I've got to bleep out private areas for privacy reasons, obviously, and then also just for Instagram reasons. But we can do a live consult and talk about a case. If you want to pull one of my before and afters from the gallery, we can talk about what we did and why. We can look at, if you want to pull a random photo from another website and say you love it or you hate it, what's going on here, we can talk about that. You see a celebrity that looks amazing or looks terrible, we can talk about that. Really anything you want. So anything plastic surgery related, the whole goal is to be informative, be entertaining, be fun, answer all your curiosities and things like that. So anyway, glad to see the participation, and keep them coming. Have a happy Tuesday, and we will see you next week.